Okay guys, this is going to be a technique demonstration for talocrural distraction manipulation. Whenever you're doing this technique, it's going to work the best whenever you have a limitation of ankle dorsiflexion. But the biggest limitation that you want to make sure that your patient will have is that conjunct external rotation of the talus that goes with dorsiflexion. So if you want, you could check it here, palpating the front of the talus and passively dorsiflexing and feeling for that external rotation motion to occur. Or, if you sit up for me, with come down this way, with the person's feet over the edge, you can do the Taylor swing test as taught by NIOMT instructors, where you're feeling for that external rotation to occur as you passively dorsiflex the ankle back and forth this way. So your contacts are on the anterior and posterior part of the talus, and you're feeling for that external rotation motion to occur or not occur. So lay back down. Because this thrust is a distraction thrust, you're not really trying to restore a glide with it. So your force will be straight longitudinally toward you, away from the ankle mortise. And when you do it, you want to make sure that your contacts are around the talus here, proximally, and you can't have too much slack taken up in the Achilles tendon because of tension within the calf. So you want to keep their foot resting in more of a neutral position. But getting here, you cannot sit down and be in this position with good body mechanics. Notice that my elbows are together inside, they're not out. And I will tend to have the patient bend their opposite knee and attempt to try and protect their lower back from any kind of excessive force that I may have. And then here, I could have the patient just push down slightly with this foot, as long as they can keep their other leg relaxed. Again, just protecting more in the lumbar spine. And then the distraction is here. You can do your pre-manipulative hold, holding a lot of tension to make sure nothing else is going to be aggravated. But when you do the thrust, I only want to take up a little bit of slack that goes toward the ankle. So that's going to be my starting position right here for the thrust. And then here, is that okay if I do that?
Yep.
For the thrust, I can take up the slack there, and then the thrust will just be like that. Just a quick distraction that way. Okay? So just keep in mind when you're doing this, you'll get cavitation and you'll get restoration of movement most often when there's that loss of external rotation at the talus with ankle dorsiflexion. And the technique is, again, elbows into the side, quick thrust towards you in that longitudinal direction.